Okay, good morning, everyone. Thank you for joining us remotely at the Center for Human Rights for the fifth of our COVID-19 pandemic alumna discussion forum. Today's discussion is on human rights protection and freedom from violence during the COVID-19 pandemic. My name is Thomas Probert. I head up the research of an initiative at the Center called Freedom from Violence, which looks to bring together human rights and public health approaches towards the problem of violence. So I can therefore say that we were thinking about the intersection of human rights and public health before it was so cool. But now, of course, the pandemic has brought a whole host of new challenges to policymakers, human rights defenders, and citizens across Africa. And it and the varying state responses to it have exacerbated a number of pre-existing conditions, so to speak, in terms of human rights protection. And so today we're going to hear from four fantastic alumna of the Center discussing various dimensions of the impact of the COVID-19 pandemic on questions of human rights protection and matters of violence. We're going to hear from Nastasia Thebaud-Bouillon-Njenga, who leads the regional Girls Advocacy Plan for Plan International in their West and Central African hub. We're going to hear from Mitchelle Oyuga, who's a current student on our Sexual and Reproductive Rights in Africa Master's Program, and may also talk about some of the work of her home organization, as it were, in Kenya. Dr. Benson Olugbuo, who is the Executive Director of the Clean Foundation in Nigeria, and Lloyd, who's a researcher at Amnesty International's regional office in Johannesburg. You've all received a copy of the flyer for this event, which gives an illustrative taste of what our speakers are going to discuss, but we'll follow the format of allowing each of them to present to us for maybe 10 minutes, and then we'll open the floor for a broader discussion. So without further ado, and now hopefully having given enough time for more participants to have joined us, I shall pass the floor over to Nastasia. Thank you.
Hi, everyone. Thank you so much, Thomas. So very happy to be part of the discussion. My name is Nastasia Thebaud-Bouillon-Njenga, and I'm an alumna of the Center for Human Rights, class of 2015. I'm currently the Girls' Rights Advocacy Lead at Plan International in West and Central Africa. And even though I will draw some examples taken from several organizations across Africa, including Plan, which I work for, the views expressed in my presentation are my own, just for a small disclaimer. So my presentation will focus on the gender impacts of COVID-19 in Africa, with a focus on girls and young women's rights. And I apologize in advance for not touching on the impact of COVID-19 on LGBTIQ+ communities. I'm aware that the presentation is not going to be very exhaustive, given the time limit. And also, unfortunately, we don't have a full picture of the impact of COVID-19 in Africa at the moment, and even less, I would say, on its gender impacts and dynamics. So it's kind of only the tip of the iceberg that we are able to see and talk about at this point. So in terms of background, and I think Thomas touched on that, I would just like to draw our attention on the fact that in terms of crisis, including COVID-19, but other types of crisis as well, we see an exacerbation, of inequalities and structural forms of violence. Africa might not be the cluster in terms of direct COVID-19 contamination, but the continent is severely affected by the secondary impacts of the crisis. And lessons from previous epidemics, such as the outbreak of Ebola in West and Central Africa, gives us a good picture of the secondary economic, social, long-term impacts that we will have to deal with. So it's not the COVID-19 itself that discriminates, but it's the pre-existing structural inequalities that are combined with the government policies to tackle the spread. All of this emphasizing discrimination for the most disadvantaged populations. And systemic forms of violence are amplified. Among them, it's clear that gender inequalities and patriarchal social norms have an impact on how women and men, girls and boys are and will also be distinctly affected by the disease, but also by the consequences. That is in terms of exposure to infection, in terms of health outcomes, in terms of ability to recover from the disease, and ability to recover from the structural economic shocks that will occur. For instance, during the Ebola crisis, due to gender norms, it has been proved that women were more likely to be infected by the virus, given the predominant roles they played as caregivers within families and as frontline healthcare workers. Something that we know for sure is that the needs of girls and young women, especially adolescent girls, are very invisible at all times, but they are especially forgotten and left unaddressed during crisis. This draws from data from a wide range of organizations, including Plan International and Girls Not Brides. And we know for sure that the COVID-19 pandemic is no exception to that. When I give more further analysis and some key facts on the gender impact of the COVID-19 outbreak and its impact on violence against women and girls, I would say gender-based violence. I want to focus on gender-based violence and child marriage in this. So the rise of GBV has been described as the second pandemic or the shadow pandemic. And according to projections from UNFPA, very recent ones, the COVID-19 pandemic is likely to undermine efforts and gender-based violence because the prevention, the protection, and the response systems are reduced and strained, even in normal times, but even more during crisis situations, such as the one we are facing. And also because of the diversion of resources towards fighting the disease. There's also an increase of the incidence of violence due to lockdown or state of emergency laws or movement restrictions. For instance, in Kenya in April, the National Council of Administration of Justice reported a significant spike in sexual offenses. So increased risk of domestic violence, increased risk of GBV in emergency settings as well, especially for refugee and IDPs, and women are at increased risk of multiple forms of violence, including sexual exploitation and abuse. This is the case, for instance, in the Sahel, in the Lake Chad Basin, in Central African Republic, in South Sudan. And for instance, women and girls will also become more at risk when traveling to collect water or to use latrines. So yeah. I would also like to draw your attention on child marriage as a form of violence and also its linkages with SRRA, sexual and reproductive health and rights. So organizations such as Plan International, UNFPA, Girls Not Brides, and others agree to say that COVID-19 heightens the risk of increase of child early and forced marriage and could threaten potentially the progress made so far on addressing this form of violence and SRRA violation. If I take again the projections from UNFPA, it indicates that over the next 10 years, due to the pandemic related disruptions, an additional 13 million child marriages could take place, 13 million. So some possible explanations: delay in program implementation because of social distancing, resources diverted to implementing the restriction of movement regulations. But most importantly, we know that pandemics increase the cases of neglect, abuse, and early pregnancy. If I take the example of Sierra Leone during Ebola, adolescent pregnancy increased by up to 65% in some communities. So this is due to increase in sexual violence against girls and young women. It's also linked to increased risk of forced and non-consensual sex, and coping mechanisms that are forcing girls and young women into survival sex or sex exploitation. And it's also strongly linked and related with the disrupted access to sexual reproductive health and rights services, including contraception. Also, we know that parents usually see marriage as a protective strategy against violence and teenage pregnancy, and also as an economic coping strategy. The disruption of child protection services as well has meant that there's no one accountable for protecting children. As an example, in Uganda, organizations expressed not long ago some concern over the shutdown of child helplines during the lockdown. So this is, it's causing a lot of alarm in the NGO sector specifically. Just to draw a parallel with FGM, according to Plan International in Somalia, for instance, the coronavirus lockdown has led to an increase in FGM, and circumcisers even going door to door, offering to cut the girls at home due to school closures. So school closures have had a really big impact on the rights of girls and young women because they are more exposed to violence. As a result, post-COVID-19, there is a high risk that married or pregnant girls and young women won't be able to return to school afterwards, which is going to increase the economic stress and coping mechanisms. Just to say that if you look at humanitarian settings, we know that such violence, child marriage, FGM, and a number of harmful practices increase during in humanitarian settings. So girls who already live in crisis situations, Sahel, Lake Chad, South Sudan, and a number of others are at even increased risk of facing such violence, and the crisis is even restraining the provision of already limited protection, already limited mental health and psychosocial support services, which are very key to survivors of GBV, for instance, and people who have suffered from different types of violence and stress due to crisis. There might also be further recruitment by armed forces and armed groups of children for different purposes, fighting or sexual exploitation, for instance, and children, especially those displaced by conflict or disasters, are at increased risk of being separated from their primary caregivers, which exposes them in turn to further violence. I think my time is up, but Thomas can confirm. I can give further details later in the questions, because I've not touched on all the gender impacts, of course, as expected. But there are a number of gender gaps in education, for instance, economic violence and exclusion from leadership roles, as well as a very big gender digital divide exacerbated by the COVID-19. I will leave it here, and I hope to have 1 or 2 minutes to speak later on maybe some recommendations. Thank you so much, everyone. Thank you for having me.
Thank you, Nastasia. Thank you both for touching on, I think, the way in which the pandemic is exacerbating risk factors for various forms of gender sexual-based violence, but also hinting at the ways in which the responses to the pandemic are interfering with the programmatic work of well, you limited yourself to non-state actors responding to those issues, and as you trailed, hopefully we can return to some of those issues in the question and answer. apropos, sorry, I should have mentioned at the beginning that the chat box of this Zoom call is open. So if at any point while someone is speaking, you're prompted to think of a question, feel free to put it in the chat box, and we will try and, depending on how many we get, we will try to coordinate them into probably the first round of Q&A before potentially getting some other inputs from the floor. But without further ado, I'll turn now to Mitchelle, who's going to take I think a slightly more rights-based perspective and talk to us about protection from torture and the right to dignity, kind of those Article 5 issues in how the pandemic has impacted the continent thus far. So Mitchelle, over to you.
Okay, thank you very much, Thomas. Good afternoon, ladies and gentlemen. My name is Mitchelle Oyuga. I'm a student at the Center for Reproductive Rights, and I'm currently working as a program officer at the Federation of Women Lawyers in Kenya. And I also like to put a disclaimer that my views are my own, and they do not reflect the views of the Federation of Women Lawyers in Kenya. I'm happy to be participating in this learning and advocacy platform. As indicated, I will be discussing the right to human dignity and freedom from torture, but my discussion will be focusing on quarantine and isolation conditions with specific regard to the Kenyan case. Well, the first COVID-19 case was reported in Kenya on 12th of March. And as expected, the government put in place measures to curb the spread. One of the measures was the suspension of international flights. And the government also issued directives that those returning into the country would be subjected to mandatory 14-day self-quarantine, will be subjected to self-quarantine for 14 days. The government also issued a strict warning that those in violation of the self-quarantine direction would be arrested, would be committed to government facilities at their own costs. When I returned back into Kenya on the 21st of March, having come to attend class in Pretoria, and I count myself lucky, because immediately we arrived, the following day, persons who are arriving into the country were not given an option of, selecting, to go home and self-quarantine for 14 days. So what we saw were videos or reports from the media that those who arrived were hauled into buses and given an option to choose where, not given a list of hotels or government facilities to choose from. Meaning that you were to select which facility depending on how deep your pockets were, because you're given an option of a 5-star hotel, a 3-star hotel, or a school dormitory. So in this particular option then was disadvantageous to those who were arriving into the country without finances, and therefore they didn't have an option rather than going to the school dormitory that were identified by the government. Now, these persons who were committed to quarantine facilities, as days went by, were able to express concerns about their health, about the conditions in the quarantine facilities, and reports from the media indicated that those in quarantine facilities decried deplorable conditions. They also complained that they did not have information on the quarantine protocols, and that the state of health, safety, and well-being was not a priority for the government. While we appreciate that the government took swift measures to curb the spread of the virus, we cannot run away from the fact that even as we put in place measures, we cannot violate human rights, or we cannot suspend human rights even in the face of, putting in place public health measures. So one of the things that was reported was that from the time the decision was made to enforce the mandatory quarantine, there has not been public information or any guidelines on the mandatory process save for the draft protocols. And then there has never been information in the public domain as to what to expect when you are committed to the quarantine facilities. The World Health Organization recommends that mandatory quarantine must be implemented in accordance with Article 3 of the International Health Regulations. And here it provides that mandatory quarantine must be fully respectful to the dignity, human rights, and fundamental freedom of persons. However, when we look at the situation in Kenya, and when we look at the open letter that was done by civil society, FIDA included, there are concerns that those in quarantine facilities were at risk of, cross-infection within the facility itself, because government had not put in place measures to ensure that even those ones in those facilities do not cross-infect themselves. Then there was also concern about the lack of information to the people under quarantine as to, how long the extension would take. And if they, if it is found that some of them have, gotten infected, the length of the extension and to whose cost and who would bear the cost of, the quarantine, being in the quarantine facilities. Then again, poor quarantine facilities. There was a video that was circulating, in social media, and one of they're termed as returnees showed us a video of the room where their rooms, how they were sharing spaces, and that particular picture was not as was contrary to WHO recommendations that provides that in quarantine facilities, the rooms must be ventilated, must be spacious, and if must be ventilated, must be spacious, and that the washroom facilities, en-suite washroom facilities. But in instances where you're not able to get that, then beds must be 1 meter apart, which was not the case in the quarantine facilities as reported by people who were in these quarantine facilities. Then the other concern was also the psychosocial effects of those in quarantine facilities. So you are arriving into the country, you're being hauled into a bus, you're being taken to this institution, you're not being told what you expect, you're not being tested within 24 hours as per the government directive. So you were there in limbo wondering what will happen to you. So from the videos we got from the people in, at Lenana school, which was like a low-level quarantine facility, to the like a 4-star, a 3-star hotels, the effect is the same. We could see, the persons showing distress, showing anxiety. So again, psychosocial effects. And then again, the other concern was the turnaround for testing. According to government directives, testing would be done within 24 hours. But we saw situations whereby you arrive at a quarantine facility and it takes the government almost a week to get you tested and to, if at all you have tested positive, to remove you from that particular environment. So even as we discuss effective ways of managing the spread of coronavirus, and even as we take note that quarantine is an essential measure for public health, there are certain safeguards that you must put in place to ensure that those that we isolate or that those that we put in these quarantine facilities, we do not violate their rights as we plan to, as we intend to protect the health of the public. We do not also violate the rights of the people who are in these quarantine facilities, because they do not cease being human beings just because maybe they were exposed to persons who had the virus. So as I close in and invite your contribution, I think we need to be aware that of some of the proposals that are given, that in quarantine settings, quarantine settings should be appropriate, in that the government should ensure that while you are there, you are provided with adequate food, water, and that the hygiene conditions are good. And that while you are there, the measures are put in place to ensure that there's no cross infection amongst the people who are there, that the minimum infection prevention and control measures are implemented, and that for the persons who are there, the measures are also put in place to ensure that there is constant monitoring of the health of the persons who are in the quarantine facilities during that time. So thank you, and I welcome your views on this.
Thank you very much, Mitchelle, for underlining the importance. I think that necessary public health interventions are provided in such a way that are safe and effective, but that also take cognizance of the psychosocial impact that they may have, and designed in such a way that people's dignity is upheld. I think thinking about the issue of dignity while the state is trying to compel various forms of behavior is something that those of us who study policing and police conduct are regularly wrestling with. So this provides a perfect kind of segue for me to ask Benson to present to us on some of the challenges of policing during a pandemic. So over to you, Dr. Olugbuo.
Yeah, thank you, Thomas. I want to also join my colleagues to thank the Center for Human Rights for giving us this opportunity. I mean, how time flies. I was in Pretoria 2003. This is 2020. It's been an interesting development, actually, in terms of policing a pandemic in Africa. And like my colleagues have also said, I want to also issue the disclaimer that I speak my personal attributes and not on behalf of the organization I work for or other organizations that I'm affiliated to. So in Africa, I think we are fighting more than one virus. That is very obvious. One, we are fighting the one that everybody knows, the coronavirus, which started somewhere in Wuhan in China. The second issue is that we are fighting hunger virus. And for that is an existential issue because a lot of people work daily to earn their living. And this pandemic has really affected the work of several people in Africa, Nigeria and other African countries inclusive. The third issue is that we are dealing with an already existential issue of mistrust between security agencies and African citizens. So that has already been there. So issues of corruption and bribery is already there. So the COVID-19 has actually exacerbated these relationships. And the final thing I think also that has impacted on the policing a pandemic in Africa is what I will also call economic inequalities that has been around for some time. So initially, there was this understanding that we were immune. Africans were immune. The black skin was tough. We had a rough gene. COVID-19 could not affect us and all those things. And we kept watching these things on television and people kept saying, no, the African man is immune from coronavirus. And then suddenly people who traveled came back and started exhibiting symptoms. And then here we are today. I mean, we are recording increasing numbers of deaths. In terms of policing, I would say that from our own little experience, security agencies were not really prepared for this because they are usually used to the normal policing in terms of they against us and us against them. You know, you are the bad guys, we are the good guys syndrome. And I think that has also impacted negatively on how we police a pandemic. So let me give you an example of what happened in Nigeria. When the government acknowledged or released the report that we now have an index case of somebody who traveled into Nigeria, we now set up what we call the Presidential Task Force, which is supposed to coordinate of all the activities. And of course, they also set up a committee, a security committee that was supposed to work in terms of security. And at a point, the government had to issue a directive of restriction of movement. And I think that's where issues started. Now, with the restriction of movement, people were exempted, what we could call essential services, and then government issued passes. For us in Nigeria, what they did is that it was decentralized. So you have the different police commands leading the other security agencies. It's more or less a task force of security agencies working together. So they could issue a pass if you're a journalist, if you're a medical doctor, if you're on essential duty to go. But interestingly also, what happened is that a lot of people were able to go and manage and get these passes for essential duties. And an issue came up, how do you know who has the original one? How do you know the one that is faked? So people, when they get to police roadblocks, they will brandish this high-level pass, and it became an issue. And if you're not able to explain yourself, then you must have something to part with before you are left. I would say that initially the security agencies were not really prepared, and it also gave an opportunity for human rights abuses. For example, in Nigeria, in the first weeks of the pandemic, especially late March and the first 2 weeks of April, we actually recorded more deaths from police extrajudicial killing and security agencies extrajudicial killing of citizens than the pandemic itself, even though the numbers now have skyrocketed. But as I speak, civil society organizations have actually recorded not less than 33 deaths, people who were killed by security agencies enforcing government restriction of movement and other policies, which for us, it's difficult to reconcile that in policing a pandemic, then the people who are actually supposed to help to fight the coronavirus are killed, unfortunately. So also trying to look at what has happened. The other issue we've also found out is that even though police can be seen to be people on essential duty, and other security agencies are also on essential duty and should actually be on the front line, but at the initial stage, you couldn't see any of them wear masks. There was this invisibility thing. So they will arrest you, they'll put their head into your car, not even knowing whether you're positive or whether you're symptomatic or asymptomatic. And it was a call for concern for several of us to remind them that the coronavirus doesn't actually know who is a security person and who is not a security person. And that's one key thing. We started calling that there was need for security agencies who are on the front line to be kitted, to have face masks, to have PPEs to the extent possible. Because unfortunately also, even the what you can call the original people, the people who meet the patients in the hospital, that's medical personnel, there was also that lack of facilities for them. So it became a very big issue. How do you ensure that security agencies who are policing the pandemic also realize the effect this could have on them? Not just only them also, but their colleagues and also the families, because basically they will always have to go home to their families and all those things. And then the other issue now is that because the pass was scarce, it gave room to bribery and corruption. So if we're able to know somebody hide up there, who get it, even though you don't really need it and all those things. And also, when the restriction was made, it was not very clear in terms of who is allowed to go and who is not allowed to go. So people who had genuine reasons, I mean, somebody who needed to go to hospital, a pregnant woman and all those things, there were issues of people who were not even allowed to move when they come out and they are called the police. And people who had urgent reasons, who had clear reasons to move, were not allowed to move until they part with some money, which even now that there's a relax in the restriction, we've also noted that in terms of interstate borders, because government has banned interstate borders from one region to the other region, but we've realized that that movement is still happening in the night, actually. So people could travel long distances, and you wonder, how do they manage? And they'll tell you that if you have some money, you could actually move as much as possible. So in terms of policing a pandemic in Africa, our intervention has not actually restricted to what has happened in Nigeria, because through the arrangement we have with the Afro-Asian Association for Justice Development, we've been having webinars on what is happening in Kenya, South Africa, Nigeria, Uganda, and even India. And interestingly, some of these countries are our colonial masters at the UK. So sometimes, interestingly, our security agencies, especially the police force, is modeled against, is a product of our colonial experience. So that has actually brought interesting things. I think in the videos you will watch, you will see that Kenya had a very interesting development, that immediately the lockdown was issued, a lot of people were abused by the police. And there were interesting videos that actually called to question whether there was a strategy to deal with COVID-19. And also, of course, in South Africa, we know the inequality that is in South Africa. So one of our colleagues who had discussed with us was like, the focus of security agencies was actually on the blacks and the communities, where, of course, they also have issues. You talk about issues of physical distancing and the fact that people cannot actually get to stay home if they need to go out and look for something to eat. Interestingly, also, we also had in Uganda that there was an increase, and I think this also cuts across most of these countries actually, increase in sexual and gender-based violence. And what has also happened is sometimes when they raise these issues, I mean, when women complain that they have been abused, people don't feel it's a big issue, even though at a point, government had now to start responding. But what has also happened is that there has been an exacerbation of sexual and gender-based violence, rape, intimacy, abuse, and this is actually under the same understanding that you should be in the same place, you cannot move. And sometimes when some people who have been abused actually report to the police, the response has not been as much as we wanted. But the good news also is that we have recorded instances where social media has actually helped security agencies to rein in on their citizens, on the citizens of security agencies who go against the rules of engagement. So we've had people being tried, suspended, and subjected to orderly room trial and dismissal from the force, based on viral videos that went on social media. Some people flogging a woman, some people beating children, some people shooting people, and then causing issues